Breaking news, the NREMT exam for EMTs and EMRs is changing this year, and these updates are a big deal. They'll directly impact how you study, how you prepare, and how you'll pass. If you're not ready, you could waste time, money, and effort. But don't worry, I've got you covered. Let's break it down together and make sure you're fully prepared for what's coming. Hi y'all, I'm that bossy paramedic girl, and I want to guide you through all things EMS education, safety, and operations. You might have heard about the changes for paramedics last year. Well, now it's the turn of EMRs and EMTs. So what's the difference? The biggest thing, the exam question formats and the domain categories. EMT is introducing TEI items, or technology enhanced items, to test your knowledge more interactively. Here's what you'll see. Build a list, arrange the steps in the correct order, drag and drop, sort items into the right categories, checkbox options, select multiple applicable answers, multiple choice, don't worry, it's the same classic format as from the previous NREMT, multiple response, pick all the correct answers, not just one. At the end of the video, I'll pull sample questions from the NREMT's website and go over them with you so that you can get familiar with them. When we say domains, we're talking about how the questions are categorized. Here is the shift. Old domains are airway, cardiology, trauma, medical, OB/GYN, and operations. The new domains are scene size-up, primary assessment, secondary assessment, patient treatment, and transport. So why does all of this matter for you? Because the new format is designed to reflect real-world EMS skills more accurately. It's important to note the content itself isn't changing, but the focus is. The new domains prioritize how you assess and treat patients in real-world scenarios, meaning your study strategy needs to shift. 49%, to be exact, will focus on primary and secondary assessment. These skills are non-negotiable for success in EMS. But here is the good news. With the right preparation, you'll have everything you need to succeed. So when do these changes take effect? Here is what you need to know. The old exam format will end on April 4th, 2025. The new format will launch April 7th. Now let's talk about what's staying the same: pricing and number of attempts. For EMRs, cost is exactly the same, $88, and for EMTs, it's still $104. You'll still have up to 6 attempts to pass. For EMRs, the exam will go from 90 to 110 questions, including up to 30 unscored pilot items with a time limit of 1 hour and 45 minutes. For EMTs, the exam will have 70 to 120 questions, including 10 unscored pilot items with a time limit of 2 hours. While the format is evolving, you're not facing any extra financial burdens or restrictions. The process itself remains consistent. But why are these changes happening? Let's take a closer look. The NREMT conducted a 2022 BLS analysis to understand the skills EMRs and EMTs need in the field in present day. They observed EMS professionals, conducted interviews, and consulted expert panels. The findings revealed that EMS roles require a stronger focus on assessment and decision-making. The updates ensure EMTs and EMRs are evaluated on real-world skills, not just textbook knowledge. These updates mean the exam now aligns with the demands of modern EMS, and that is a win for the profession. Now, I want to bring into the discussion the zero to hero or getting truck experience prior to paramedic school, because at some point after you pass the EMT exam, you will inevitably consider if you want to go to paramedic school. One of the most significant changes which is a foundational EMT skill. So what does this mean for your career path? Skills like scene safety, scene size-up, and patient assessment aren't just basic skills, they are the backbone of EMS. No matter how advanced your knowledge becomes, these foundational skills are critical. And confidence in those foundational skills is what separates a mediocre paramedic from a great one. If you're still shaky on the basics, take the time to master them first. It could make the difference when it really counts. Okay, now these changes may seem overwhelming, but before you panic, I want to share some good news. When similar updates rolled out for the paramedics and AEMTs, pass rates actually improved. If I remember correctly, AEMTs pass rates improved by 5.8% and paramedics by 1.2%. The test number reflects real-world skills and more people are succeeding. These updates make the test more meaningful. Passing the exam means you're proving that you're ready to handle the challenges of EMS. You've chosen a career path where lives depend on you, and that's no small thing. These changes are just one step towards becoming the best version of yourself in this profession. So take a deep breath, start preparing today, and focus on mastering these assessment skills. Drop a comment below with your thoughts and questions. I'm here to help you succeed. Let's tackle this together. All right, guys, just a few things before we get started. First off, I'm going to give you guys this free tool to help you through patient assessment. It's just the bare bones structure of a patient assessment by NREMT standards. So what this is going to do is going to give you a little guide to start helping you identify the different portions of your assessment And one of the things that I really love about the NREMT exam updates is this emphasis on patient assessment. So what that translates to is if you are really going into SIMS, taking them seriously, and understanding the different portions of the assessment, that's only going to help you pass the NREMT exam. And I absolutely love that. So here they are if you want to take screenshots of them. I'm also going to try to have them available at the link in my bio, as well as all of these sample packets, whether you're a EMT, paramedic, EMR, EMT. I'm trying to have that up in the link in my bio soon, but I'm having some issues. If you type in your level of certification, sample packet, and enter EMT, it should come up pretty quickly on Google. Those of y'all who don't know, I'm actually coming out with my own app. It's called Flashcards on Steroids, and it's going to basically be a supplemental tool for NREMT. I'll have it up hopefully in about a month with all these free resources there as well. I also want to add in that there is no answer key on this sample packet. I'm giving you guys my rationale of how I arrive at specific answers, so use your best judgment. So we'll first go through the different domains, and then we'll move on to the TEI items once we're done with those. A 21-year-old patient is in labor. The EMT considers whether HIV or hepatitis B could be transmitted to the fetus. Which of these diseases could be transmitted to the fetus, if either? This one is very straightforward. HIV and hepatitis B can both be transmitted through fluid-on-fluid contact, so it's a very good, reasonable concern for the EMT to consider prior to going on scene when considering resources and your scene size up, scene, BS appropriate PPE. So the correct answer here would be C, both diseases. A 7-year-old patient has chest pain and difficulty breathing after receiving blunt trauma to the chest. There is bruising on the right anterior chest wall without any deformity. Lung sounds are clear. The vitals are BP 102/60, pulse 120, respiration 32 and shallow, SpO2 93% on room air. Which of the following conditions should the EMT strongly suspect? Okay, so when we first look at our answers, it does seem like it could be a bit of a doozy, everything, all this could fit. But I promise, if we go through process of elimination, it's going to make a lot more sense. So let's go into it first. So fractured ribs is our first answer. Well, in this question, it says no deformities noted. Okay, so we know there's no deformities, so we can't have any fractured ribs. Okay, cardiac tamponade. We said it's the right anterior chest, so the front right of our chest. Our heart is on the left side, so we can pretty easily rule out cardiac tamponade here if our trauma and our bruising is on the right side of the chest. Pulmonary contusion. Okay, I actually like that one for this one because we have a lower SpO2 rate, the shallow respirations. If you have pulmonary contusion, which is basically bruising to the lung tissue itself, patients can very often report that they're having pain while breathing, which could explain the shallow respirations. Okay, and then but let's go on to the last one and see what we have here. D, tension pneumothorax. Okay, so a tension pneumo versus a simple pneumo. We could maybe make simple pneumothorax work for this one, but tension pneumo, we're going to have that shift of the mediastinum. We're going to have that JVD, that tracheal deviation, absent lung sounds. There's nothing like that on this test question. So in my opinion, the correct answer here would be C, pulmonary contusion. Okay, this one's a good one because I think this one could kind of go either way. There's two answers that I'm going back and forth with. During transport to the hospital, a 47-year-old patient involved in a motorcycle collision begins to report a tearing-like pain in their back and right arm. The vital signs are BP 82/52, pulses 130, respiration 32, SpO2 90% on room air. Which of the following conditions should the EMT most strongly suspect? So again, let's go through our process of elimination. Answer A, aortic dissection. Anytime you hear any type of tearing pain, you should be thinking of an aortic dissection or AAA or something like that, especially if you're having back pain or stomach pain. Answer B is a pulmonary contusion. We just went over that one. The only reason I'm hesitant of pulmonary contusion is because of the tearing-like pain. That's not really reported with the sensations of pulmonary contusion, so that one's probably going down to the bottom of my list. C, pericardial tamponade. Okay, so for pericardial tamponade, we have to think about Beck's triad, which is our muffled heart tones, low blood pressure, and JVD. We have our low blood pressure, but the other ones are not being reported in this patient. I feel like if our EMT wanted us to pick that answer, they would give us more towards the Beck's triad. So I'm going to probably put pericardial tamponade down towards the bottom. And now we get to our last answer, which is D, tension pneumothorax. Okay, so again, tension pneumo, we have that shift of the medium sinum, we have absent lung sounds, we have JVD, tracheal deviation. They're not giving us anything here. Now, think about what's happening in a tension pneumo. The lining of your lungs is detached. that could be a sensation that patients report with pneumothorax. However, like I said, NREMT typically likes to stick with your classic signs and symptoms. So for this answer, you could definitely make a case for D, but I believe the correct answer to be A, aortic dissection. But let me know what you think in the comments. What medication would be contraindicated for a patient who has taken sildenafil within the last 24 hours? So sildenafil is an erectile dysfunction medication. So usually when we talk about erectile dysfunction medications, the main thing that's going to be contraindicated is something else that's going to make us vasodilate. So does aspirin make us vasodilate? Absolutely not. It's going to prevent our blood from sticking together. We give that in MI. Prevents clots from getting worse. Albuterol is a beta-2 agonist. It's going to make our bronchioles dilate, but it's not going to make our venous system dilate. It's also going to cause those beta properties of making our heart beat faster, which is, again, not something we're worried about in terms of a contraindication for an erectile dysfunction medication. Naloxone, that's not a consideration at all. Nitroglycerin absolutely makes us vasodilate, so it would absolutely be contraindicated in this patient. So the correct answer is D, nitroglycerin. An 87-year-old patient had a ground level fall at home and requested a lift assist. The patient is alert and oriented with no injuries. The patient lives alone and does not want to be transported. The vital signs are BP 130 over 78, pulse 72, respirations 12, SpO2 96% on room air. The EMT is considering notifying law enforcement or documenting the findings as possible actions. Which of these actions should the EM take, if either? So let's see. A, notify law enforcement. I don't see any reason to notify law enforcement. There's no signs of neglect, abuse, or the patient not being able to take care of himself, or any homicidal, suicidal ideations based off what they're saying in this call. Document the findings. I would agree with that. We should document the findings, because if you don't document it, it didn't happen. Even if it's something as rudimentary as a refusal. And C and D, both actions or neither actions, I don't agree with either of those. I believe the correct answer here is B, document the findings. All right, now we are moving on to our TEI items. So our first one right out the gate is a multiple response. What must be proven in order for an EMT to be found guilty of negligence? Select 3 answers options that apply. So it's important to note that you may get some questions that want you to answer 2 or some that want you to answer 3. It will prompt you in the question, however. So let's look at our first couple of answers. The EMT had a duty to act. Yes, that is correct. The EMT breached their duty to act. That is also correct. The EMT improperly transferred care. I mean, that could get you in trouble, but that's not necessary to prove negligence. The EMT transported without consent. Again, could get you in trouble, but not part of negligence. The EMT's actions resulted in injury to the patient. Yes, that is the last one, and then we'll just read the last one, F. The EMT shared patient information with bystanders. Again, that's a HIPAA violation, but not something necessary to prove negligence. Our correct answers here would be A, B, and E. Next, we have our drag and drop style. So we have compensated and uncompensated shock as our 2 options. So we'll each 3 of the compensated and 3 uncompensated will go into each box, basically. So let's read the question. A 32-year-old patient has a multiple gunshot wound with massive hemorrhage. All external hemorrhage is controlled. What signs and symptoms would indicate that the patient is compensated or uncompensated shock? Move the stage of shock into the answer area to show which sign or symptom of shock corresponds with the stage. So our first one is BP 96 over 52. Okay, so that's above 90 systolic. And if you need, if you would like to calculate the MAP, I'll throw the formula up on the screen. There's also a calculator function that you can use here. It's not an interactive PDF, so I can't show y'all. But the MAP is a perfusing MAP. This patient did the math earlier. So this will go in compensated shock, BP 88 over 50, again, below 90, below target MAP as well here. So it will go under the uncompensated shock category. Patient is lethargic, so that's going to be a decreased mental status. So decreased mental status is absolutely a sign of uncompensated shock. Anxiety is a sign of compensated shock, very, very common in patients. A pulse of 64, okay, that's a sign of uncompensated shock. So with shock, our heart rate initially will go up in an attempt to get blood and oxygen to the rest of the body, because there's something else that's keeping it from getting there. But at a certain point, our bodies will stop trying to compensate and they'll start to slowly go back down. So 64 would be our uncompensated shock and 122 would be our compensated shock. Next style of question is build a list. So you basically just have to put everything in the correct order. A 17-year-old patient is unresponsive. The patient has 2 mm pupils and shallow, irregular respirations. What order of actions should the EMT take to administer intranasal naloxone? Move the options into the answer area to show the correct
order of actions. Okay, so let's look and see which ones we have. Attach the atomizer to the syringe, confirm proper medication and dosage, ensure nostrils are clear of any obstructions, administer half a dose in each nostril. Okay, so we want to always confirm our rights. There's so many rights now. When I went through, it was 6 rights, so we'll just go with that for the sake of this answer. We always want to go through our 6 rights, confirm that we have our right dose, right medication, right patient, all that good stuff. The second thing I would do is ensure the nostrils are clear of any obstructions. Who cares about how much we're putting in or attaching the atomizer if the nostrils aren't clear and the medication cannot be absorbed? Next step would be attach the atomizer to the syringe and then administer half a dose in each nostril. Alrighty guys, saving the best for last, we have our options box last. So basically we're going to select one or the other answers to support one or the other potential diagnoses. A 32-year-old patient with dysphoria is found talking to themselves. The patient is continuously looking around and asking the EMT, "Can you see the dragon?" The skin is diaphoretic and hot to the touch. Vital signs are BP 180 over 98, pulse 160, respirations 20 a minute, O2 95% on room air, CBG is 60. What assessment findings support a differential diagnosis of alcohol intoxication, and what findings support delirium? In the table below, select 2 supported diagnoses of alcohol intoxication for corresponding findings, and select the 2 supported diagnoses of delirium for corresponding findings. So the first one is dysphoria. That's basically just like a difficulty communicating. Very simple breakdown of that answer, but basically it's just difficulty communicating, or maybe even like slurred words. That one I'll put alcohol intoxication. Paranoia I would absolutely put under delirium. The patient is hypertensive, and that could be commonly seen in patients who are intoxicated. So I would say blood pressure of 180 over 98 in the alcohol intoxication column, and then a CBG of 60. So that's pretty common in delirium, that patients are lower CBG or lower side of normal. Not necessarily how we consider it textbook when we're treating low blood glucose, but lower side of normal to low is more common in in the delirium column. So for that answer, I'm going to put delirium. Now, before we wrap up, guys, I do want to let y'all know that you have to get all of the answers correct. So when you have multiple responses, every single answer has to be correct. There is no partial credit, which I think kind of sucks, because some of these answers you could argue are a bit subjective. But that is just the way NREMT has it situated. If you have any questions, please let me know. I will answer the comments, and yeah, good luck, guys. Let me know if you have any questions, and good luck, guys.